Here is the muscle injury classification from Müller-Wohlfahrt et al. 2013. Type 1A, fatigue-induced muscle disorder. Increased muscle tone from overexertion. Symptoms are commonly aching in the entire muscle and increased muscle firmness, as opposed to pain. The athlete will report muscle tightness. Ekstrand et al. 2013 found that footballers with fatigue-induced muscle disorder miss just 8 days of sport on average. Type 1B, delayed onset muscle soreness, DOMS. More generalized muscle pain following unaccustomed eccentric deceleration movements. Acute inflammatory type pain, pain at rest, usually peaks at 48 to 72 hours after activity. Type 2A, spine-related neuromuscular disorder. Increased muscle tone caused by a functional or structural spino-lumbopelvic disorder. Symptoms are commonly aching in the entire muscle and increased muscle firmness. Pain will increase with continued activity but should go away with rest. There will be discrete edema between the muscle and fascia, and there can be increased sensitivity to touch and stretch, but this is not a structural injury and a scan will just show edema. Type 2B, muscle-related neuromuscular disorder. Increased muscle tone, but often it will be a smaller area of muscle and not the full length. This type of injury often results from dysfunctional neuromuscular control. Like the previous types, there is aching and tension along with cramp-like pain. Unlike the previous types, there will be more obvious edematous swelling, so this will be the only thing that can be seen on a scan. Type 3A, minor partial muscle tear. Now we get to the structural types of muscle injury that most people are aware of and would call a strain. This type of tear will have a maximum diameter of less than a muscle fascicle bundle. Symptoms are usually a sharp or stabbing pain at the time of injury, so pain is instant and it will be localized pain. Sometimes it is possible to palpate the tear in the fiber structure with a firm muscle band, and early stretching will exacerbate symptoms. An MRI would be positive for fiber disruption on a high resolution, and it would detect intramuscular hematoma also. Type 3B, moderate partial muscle tear. This type of tear will have a diameter of greater than a muscle fascicle bundle. Symptoms are usually a sharp or stabbing pain with a tearing sensation at the time of injury. So pain is instant and it will be localized pain. It is common to palpate the tear, and early stretching will exacerbate the symptoms. An MRI could be positive for significant fiber disruption, probably including some retraction. There is commonly fascial injury and intramuscular hematoma. Type 4, sub or total muscle tear, tendinous avulsion. This type of tear involves the subtotal or a complete muscle diameter or tendinous injury. There will be a dull pain at the time of injury with a very noticeable tearing. The athlete will often experience a snap, followed by a sudden onset of localized pain. There will be a large deficit in muscle strength with significant hematoma, and a gap can be palpated due to muscular retraction. Contusion, direct injury. This is caused by muscle trauma, caused by a blunt external force. This will lead to hematoma within the muscle, causing pain and loss of motion. Pain will be dull at the time of injury, but will likely increase as the hematoma increases. If the contusion is very large, then this can cause compartment syndrome.